everyone, and good evening. I know you probably had a long day, you probably had a full day, but I want to start by saying thank you for taking time to tune into the Health Horizon Show. Welcome so much to episode 2 of the Health Horizon Show. I'm Kara, your host, and I am so glad that you chose to tune in to the Health Horizon Show today. Today we are going to dive into something that women deal with every month. Every woman deals with this thing every month, and that thing is menstrual cramps. Menstrual cramps. But before we dive in, I want to say something, and I want to say that for far too long, reproductive health has been viewed as a women's only topic, and that is not how it's supposed to be. Um, um, it's a topic that involves husbands, involves boyfriends, involves everybody in the society. So, husbands, fiancés, boyfriends, you're part of this story too. Because for far too long, we have had this idea of reproductive health is a woman's topic. So, as long as it's a woman's topic, you find that husbands are not concerned, men are not concerned too. But today, I want to tell us that men, you're part of this story as well. And it doesn't actually stop there. This episode is also for parents. Parents, every parent with a teenage girl, every parent who is taking care of a girl, or maybe you just have a girl in your life, maybe your niece, maybe your daughter. This episode is for you. So today we are asking ourselves, is your period pain trying to tell you something? Is it just cramps, or is it a condition? What is normal and what is not normal when it comes to periods? Okay? But before that, I want to make you understand why reproductive health is not a woman's issue. Number one is because reproductive health does not only affect women. This is something that affects families. It is something that affects relationships. It is something that affects the society at large. Because we find that when a woman is struggling with that period pain so bad that she can't even go to work, she can't go to school, she can't go to the social events simply because she's having her periods. So this is something that is going to affect where she's working. It's something that is going to affect her family, something that is going to affect the kids and the society at large. So husbands, boyfriends, this concerns you too, because a woman you love could be your wife, could be your sister, could be your daughter, could be suffering silent, could be suffering in silence because of this thing, cramps, and it's not supposed to be so. We normally say that periods are not supposed to derail your life. They're not supposed to stop you from living your life. They're not supposed to affect your daily life. Like, you cannot do some things like going to work, you can't go to school, you can't attend some social events because you're on your periods. It's not supposed to be so. So men, this you're part of this story, because when your girlfriend, when your wife is curled up in pain every month, struggling to function, that's not normal. Because I know that men, you have this idea in your minds that when a lady is complaining about their cramps too much, you call it drama, and you tend to make it look like we are being dramatic. But that's not the case. Actually, it's an experience that varies from person to person. So if you find that a woman in your life is behaving, or maybe you're saying it's more dramatic maybe than what you have seen before. For example, maybe I'm in a relationship and this person is telling me like, I had my ex, this is not how she was behaving when she was having her periods and all that. But one thing that we need to understand is that periods, the experience is different from one person to another. So one thing I want us to understand is that you cannot support someone that you have not understood. You cannot support me if you don't have an idea of what I need. You cannot support me if you don't have an idea of the challenges I'm facing. That is why today I want to make you understand what is normal and what is not normal when it comes to period pain, so that before you call it drama, man, before you tell that lady that she's being dramatic, you'll have a clue and you'll have an understanding. What does it mean to have normal period pain, and what does it mean to have abnormal period pains? Okay, and actually, before we dive in deeper, there are ways that you can help. You can actually help that woman in your life. And number one, how you can help her is by help her track her symptoms. By the end of this episode, I'll have taught you what it means to have normal period pain, and what it means to have abnormal period or abnormal period pains. Okay, so you can help her by helping her track her symptoms. That is now when you'll be able she'll be able to understand, this is not normal. If I see this is normal, this is not normal. Yeah. Number two way of in which you can help her is by encouraging her to see a doctor in case something that's alarming happens. That is why I'm saying we are going to dive into understanding what's normal and what's not normal. So you can support her by encouraging her to see a doctor in case something that is alarming occurs. And number three, you can also help her by offering emotional support instead of dismissing her pain. I know men are so good sometimes, especially when it comes to periods. You have this idea of actually most men don't like talking about it, and sometimes it gets to a point that you make her feel like she's being dramatic when she's not being dramatic. So it is very important for you to offer emotional support instead of dismissing her pain. Whenever she tells you that this pain is too much, please show some concern. Okay, the other thing that you can do to support her is to reduce stigma around discussing periods openly, because actually there are ladies out there who can't just talk about periods, because maybe growing up they didn't grow up with people who created an environment for them to talk about periods openly. Some of them were brought up by their fathers, by their even mothers, but these mothers were not open enough. And so you find that the only information that this girl has concerning periods and menstruation is that science that she learned when she was in class 6, that when you get to adolescence, this is what happens and all that. So she doesn't have details, and also she's afraid to talk about it because growing up she didn't have a person, who encouraged her to talk about it. Okay, so you can help a lady by helping her to reduce stigma, because if this lady is not stigmatized about talking about period pains, anytime she has an issue with her periods, maybe she's experiencing some abnormal period pains and all that, if she's not stigmatized, she's going to talk to you, she's going to openly talk about it. Okay, also I want us to understand why parents need to be involved in this matter. To every parent, you're having a girl, you're having it might be your daughter, might be your niece, but they are nearing that reproductive age, or maybe actually they are in that reproductive age. What happens, and the truth of the matter is, parents, you're the first line of information and support. So whatever you feed this child, this young girl with right now when she's still young, this is what is going to carry her for the rest of her life. So you find that if a girl was told that from a young age, she was told that, period pains, this is just something that you have to endure, it's womanhood, and even when it gets worse, you're not supposed to talk about it, you're not supposed to complain because it's normal for a woman. That's bad. It's very important that we get to understand what's normal and what's not normal, so that even as you're giving this information to this child, she'll grow up knowing that this is what is normal. If this pain goes beyond this, then something is off somewhere. Okay, so parents, you're the first line of information, you're the first line of support to these girls. Okay, so what you feed them with matters, and matters a lot, because now you see, if a girl has been taught to enjoy this pain, so even when it gets worse, she won't know, because in her mind she knows it's supposed to be this way, and after all, it is womanhood, I'm just supposed to endure. Okay, so actually it's very dangerous, because a girl could be just suffering in silence, and you have no clue that maybe they are suffering something serious like endometriosis. she has been experiencing that kind of pain, but because she was taught this is womanhood, you don't complain, you don't speak about your period, you see. So that is why parents, this topic, parents, you need to be very attentive, and you really need to be you need to be you need to have that information so that you can share it with your girls. Also, it's very important that we talk to our boys, and also let's just raise young men, young men that are not afraid to talk about periods, young men that are not afraid to say period. You see, over time I've seen that men struggle to talk about periods. By the way, I don't know if it's because of that African culture, I don't know, but it's very difficult sometimes for man to just be talking about periods with a lady. So this is a call for everyone. Today's episode is for everyone, because reproductive health is not, I repeat again, reproductive health is not a woman's topic. It affects relationships, it affects society at large, it affects families, and all that. The reason is why I'm saying this is because you might think that reproductive health does not concern you. Women's reproductive health does not concern you because maybe women mama boys, so you feel like you don't have. But it's very important for you to raise a boy or to raise a man from a young age, someone who will know how to support the women in their lives. Okay. And so today's episode is for every man who wants to be a supportive partner. It is for every parent who wants to raise an empowered daughter. It is for it is just for a parent who would like to raise a supportive man since they are young. Okay, because in reproductive health we are in this together. Because if your wife is struggling with that period pain for days, that is going to affect you as a husband. It's going to affect the kids. It's going to affect a lot, because you find that this woman cannot even go to work, they can't go to school and all that. So I want us to first understand, I want to start by making us understand what is normal period pain, or what is normal. Okay, when do we say that the period is normal? The cramps, the timing, the duration and all that. Number one aspect that we use to maybe to assess whether the period is normal is timing. This pain, the period pain in normal circumstances starts 1 to 2 days before your period, of which it's different from every person. It varies from person to person. So it starts 1 to 2 days before your period, and to some the cramps start that the day that you start bleeding. Okay, so you might feel uncomfortable, you might feel fatigued, some might feel some bloating. That's normal until those symptoms become intense. The next thing is duration. Periods, the normal days that period is supposed to last is 3 to 7 days. There are people who have their periods for 2 days, others 3 days, others 4 days, others 7 days. But normal periods, they're not supposed to last beyond the 7th day. Also, normal period pain is manageable with mild painkillers. These over-the-counter drugs that you go for when you're having your periods, akina Brufen, akina Buscopan. If that period pain is normal, it's supposed to be manageable with such kind of medications. Okay. Also, we can use something else we can use to know that whether your period pain is normal or not is the impact that pain brings to you, or the impact of that pain in your life. There are people who experience a period where every time they're having their periods, their lives are derailed completely. This person will not go to work. This person will not go to school and all that. So we normally say that periods, they are not supposed to drastically interfere with your daily living. You're not supposed to miss work. You're not supposed to miss school because you're having your periods. You're not supposed to miss those social events because you're having your periods. And it's very normal for the period to be accompanied by symptoms like bloating, a feeling of fullness in your abdomen. You may feel fatigued, you may feel so tired, sometimes nauseated. Yeah, but if it gets so intense and it starts affecting your daily life, then that one is something to get concerned about. Okay, so what are the red flags? When do we say that that period pain is not normal, or when do we say that that period is not normal? When do we say that these are red flags? We say that something is a red flag, for example, when you're having severe pain that keeps you from living your life. Period pains are not supposed to keep you from going they're not supposed to make you not go for work. They're not supposed to make you not go to school. They're not supposed to derail your life. They're not supposed to stop you from living. Okay, so also, if that pain is prolonged, we say that normal periods last for 3 to 7 days. So if that pain is prolonged and goes beyond the seventh day, or maybe even sometimes persists even through the cycle, then that one is a red flag. Okay, also the kind of pain that is accompanied by very heavy bleeding, accompanied by clots. If you see your clots and you're having your periods, big large clots, if your period comes with fever that is so severe, then that is a red flag. That is something that when you see, it calls for medical attention. Also, pain that gets worse over time. You know, some people experience this kind of pain that your period pains were once manageable. You could just take these mild painkillers and you're good. The pain could respond to these meds, but a point came, and you started feeling like that pain is not manageable, started feeling unbearable. Then if that pain has worsened over time, then it is something that needs medical evaluation. And what are some of these possible causes of these abnormal period pains? Like when you have that when you experience this kind of symptoms, the severe pain, the heavy bleeding, the clots, periods that last beyond goes beyond 7 days, that is a point of concern. And so there are possible causes of abnormal period pain. Sometimes you might just think that it's just pain, it's just periods, but there are possible underlying issues that could be causing your these abnormal periods or abnormal period pains. Number one possible cause is endometriosis. Endometriosis is a very chronic disease, and this is where tissues that are similar to the lining of the uterus grows outside the uterus. As I said in the previous episode, I am not trying to make this look like a medical class. I want to come down to your level, so I'm trying at my level best not to use jargons and those medical terms that you normally use. But endometriosis presents with painful periods, and this kind of pain is that kind of pain that I'm saying. It is not relieved by mild painkillers like brufen and acnabascopan and all that. So it prevents this very severe pain, and this pain worsens over time and starts a few days before your period, and sometimes it may continue throughout your cycle. So if your pain lasts beyond the seventh day, then that's an alarm. Also, if you have endometriosis, you're likely to experience painful urination, especially when you're having your menses. You're having to experience painful urination. Also, you have heavy bleeding. That could be a sign that you have endometriosis. We said that the intensity of normal period pain is from mild to moderate, but the intensity of pain that is as a result of endometriosis is quite severe. So if you have those very painful period pains, then that is a cause. That is an alarming issue, and it means that you need to go get checked out. Okay? So if your cramps have become resistant to pain, if your period pains have become resistant to pain, then it's something that should make you go see a gynecologist. Okay? You see, the average time to diagnose endometriosis is 7 to 10 years. So imagine experiencing this kind of pain for all that time. That's a decade. That's a decade of pain. It's a decade of confusion. It's a decade of feeling less visible. So it is very important that you just go get checked. Doesn't hurt to go and seek help. Doesn't hurt to go get checked. we're going to run some tests and all that, do ultrasounds, and it won't hurt at all for you to just go for medical checkup. The other possible cause of this abnormal period pains is something we call adenomyosis. This occurs where the tissue that normally lines the uterus grows in the muscular wall of the uterus, and this actually results into an enlarged uterus and of course heavy bleeding. So the following are the symptoms of adenomyosis. We have severe menstrual cramps that gets worse over time. You're going to experience very severe menstrual cramps, and these are cramps that gets worse over time. Okay, you're also going to experience heavy menstrual bleeding. You're going to experience a feeling of bloating or fullness in your abdomen. Sometimes you'll feel like you're pregnant and you're not. And a person who is also battling adenomyosis is likely to experience painful sex. The pain is more intense. The pain when you have the cramps, they are more intense than when you have regular cramps, and we have said that they worsen over time. And this kind of pain may not fully respond to the over-the-counter drugs like brufen, as we said. So in case you have such, when you're having your menses, these are some of the things that you experience, then that to tell you that you need medical evaluation ASAP. Okay. The other possible cause of such kind of pain is this abnormal period pains or abnormal period cycles and all that is uterine fibroids. We all know what fibroids are. We in a layman's language, these are growths. It's a growth in the uterus, and they are normally non-cancerous. They are not cancerous. And so when you have fibroids, you're likely to present with long periods that lasts beyond 7 days. So if your period lasts beyond 7 days, then that's a call for attention. Also, when you're having your periods, you're likely to pass very large clots. Then you experience severe cramps. You experience bloating, a feeling of fullness in the abdomen, and actually your especially your lower abdomen, it appears swollen in a way. And actually, definitely, if you have fibroids, you're likely to have anemia because of the heavy bleeding. So you're going to know that you have anemia if you have a pale skin, you have dizziness, you have fatigue, and all that. So you see, the reason is why I said that reproductive health is not a woman's issue. It is something that involves the society at large. Something that we say that affects relationships. Because assuming that you just got married to a lady, she has been having very painful cramps when you guys were in a relationship. Now you guys are married, and after 1 year she's diagnosed with something like fibroids. So you understand that thing is not going to affect this lady. It's going to affect you. It's going to affect her in-laws, because the very first fear that comes every time you hear someone has fibroids is, will they be able to conceive and all that. So instead of that is why I'm saying that you need to go for checkups. Men, you have to encourage your girls, you have to encourage the women in your lives to see a doctor every time they have something that doesn't appear normal. Okay. The other possible cause of these abnormal periods and abnormal period pains is something we call polycystic ovary syndrome. This is basically a hormone disorder that affects how the ovaries function. And some of the symptoms that you have this condition is that you'll experience absent periods. And the absent periods, it's definitely because of the hormonal imbalance that affects ovulation. Sometimes you realize that you're going to have irregular ovulation. And I know that most, especially ladies, sometimes you're so happy when you miss your periods. You're not married, so you're not pregnant, yeah, but you missed your period, and you're very, very happy because now you know that you're free from that pain, you're free from that trauma and all that. But one thing I want us to understand is that every time you miss your period and you're not pregnant, that's an alarm. It is something that should shock you. You're actually supposed to be very happy every time you see your periods, but every time you miss your period and and you're very, very sure that I am not pregnant, then you're supposed to go get checked out. Okay. So the effect of the absence of the periods, we said that you miss your periods because of the hormonal imbalance. We said that this condition affects how your ovaries function. The absence of period will definitely bring about difficulties in you're going to it's going to make it difficult for you to conceive. It's going to be so difficult for you to become pregnant. And also this is going to it might actually complicate and bring about certain health issues like endometrial hyperplasia. This is where now the uterine lining becomes so thick, and it is not cancerous, but in some cases it progresses to something like endometrial cancer if it is not properly managed. So if you have a symptom, don't wait for tomorrow. Don't say it is normal. If you just have even if it is one of these symptoms that I'm saying, it makes you eligible to go for a checkup. Okay. Also, when you have this condition, you experience very heavy and prolonged bleeding when periods occur. You see, now you've been missing your periods for a long time. When they come, they are likely to be very heavy and they are likely to be prolonged. Okay. Also, you're likely to gain a lot of weight, especially around your belly, and also you have difficulties in losing weight. So we talked about infertility, that is the inability to conceive, because now if you're not ovulating, then you won't become pregnant. And you realize that some of these symptoms, they lead to a lot of social stigma, because now when you become infertile, when you have obesity, when you have unwanted hair growth, I forgot to tell you that this condition will cause the ovaries to produce excess androgens and testosterone, which are actually hormones that are more in men. So what happens when you produce a lot of androgens and testosterone is that you're going to have something like unwanted hair growth. Like you realize that it's a lady, but you're having hair on your chest, on your abdomen, which is actually stigmatizing for a lady. So others may actually experience hair loss, but hair loss that is caused by this condition is actually not reversible unless you go for treatment. So if you have this kind of signs, stop assuming, stop saying it's normal, it will get better after childbirth and all that. You're risking your life. So all these conditions actually, as we have seen, they cause heavy bleeding, and this would lead to more serious health problems like anemia. So you can actually prevent anemia by okay, if you treat, of course, if you treat these conditions like fibroids, you're going to save yourself from something like anemia. Infertility is also a common symptom. And also I want us to understand that early diagnosis prevents long-term complications. If you're diagnosed early with fibroids, it is not the same as when you're diagnosed late. That is why I'm saying that men, you're part of this story as well. You're part of this story, because if that girl that you're in a relationship with begins to have such symptoms when you're actually in a courtship, and you're not concerned, you just buy her chocolate, you take flowers to her, just buying her snacks and all that, but you're never concerned. How is your period? How is your pain? How is your bleeding? Is it too heavy? Is there something alarming? So you guys are just going to run a relationship very well, but then maybe after 5 years, this lady becomes diagnosed with endometriosis, with fibroids, with all these things, and it's actually going to affect you as a man. That is why I'm saying it's very important for you to be very concerned and to be very to be there for the women that are in your life. And actually, the reason is why many women experience years of delay before getting an accurate diagnosis is because people are normalizing pain. We have normalized pain so much that you're like, I'm a woman, I'm just supposed to enjoy it. That is what the society has lied to us. But let me tell you, pain is a signal, and if it is stopping you from living your life, it deserves attention. And actually, early diagnosis makes a substantial difference. And so if you happen to have any of these signs, don't hesitate, seek medical attention. We say that it doesn't hurt for you to seek medical attention. And so that brings us to the end of today's episode of the Health Horizon Show. And if anything that we discussed today resonated with you, or sparked a question, don't keep it for yourself. It is very important that you share your experience. It might make someone else feel less alone. So if you have any question, you can drop it on the comment section. I promise you that I'll be checking in and I'll be responding as well. So until next time, take care of your body. Keep pushing for better health. Keep pushing for better health. So see you in the next episode, and remember that your health is your power. Thank you.